And also all the questions will be asked online. I hope next year we will be here again, all in this UN building. Dear Mr. Chair, thanks for the opportunity to discuss with you very important questions by civil society organizations. It's great tradition. Thanks again for coming. We received 11 questions from different NGOs from different countries and areas of drug policy. Some of them, or as I know, all of them will be asked online. First of all, it's great pleasure to give short welcome remarks by the CND chair. Mr. Ambassador, the floor is yours.
Thank you very much, Matej, and good morning to you all, or good afternoon or good evening, wherever you may be. This is an informal dialogue. I'm sorry I'm wearing a tie. Should have thought better. But I'll try to be informal, even if I don't look it. I attach a lot of importance to this dialogue with civil society, and actually I think we should have it more often. And I've already told Jamie, and I'm telling you now that I'm available throughout the year, so not just during the session, but also throughout the year. And I think we should have maybe a morning or an afternoon with you, so with the Vienna-based organizations then later on. I'm very pleased that some of you are here in Vienna. This is an important meeting because multilateralism is facing some challenges. Speaking just for 1 minute now as a Belgian diplomat, Belgium is very much committed to rules-based multilateralism. So you will see that probably reflected in the way I'm conducting these meetings. It is my firm belief that this Commission on Narcotic Drugs, which has a venerable age, just a bit older than I am, 65 years, this commission has been doing a very important work for the international community. You may disagree with me on that. Of course, that is totally acceptable. But as I hope that you will allow me also to give my opinion, which is that rules-based multilateralism is key, that member states need to work together in a peaceful way, in a respectful way, and in a constructive way. And I think your questions are also on, how can we go forward? And I'm very pleased that you're asking those questions, because that's also basically what we are here for, to go forward in dialogue with everyone and to try and take decisions. I can tell you, those who have followed this week, that taking decisions is not that obvious nowadays, but we will steam ahead and continue with our work. I'm happy to also discuss the work, but I think now I really need to be here to listen to you and to answer your questions. So sorry for those very short remarks, but we can expand a bit later if there's time. Thank you so much.
Okay, thank you, Mr. Ambassador. So with your permission, we shall start with questions. First will be presented by Association Proyecto Hombre from Spain, and Elena Presencio is with us. So please, Elena, the floor is yours.
Thanks, sir. Question. Numerous national and international reports reflect the enormous impact that the COVID pandemic has had on vulnerable groups, such as people with substance use disorders, especially on mental health and socio-occupational integration areas. The strengthening of alliances between civil society and governments has become a good practice to better face this emerging situation in many regions of the world. From the Commission, what policies should be promoted in our countries to give continuity and to enhance these partnerships? Thank you very much.
Thank you very much. Buenos dias. The Commission on Narcotic Drugs was set up to address the problems of which individual people have with substance disorders and substance abuse. So you could actually say that from its very beginning, we have already been focusing on vulnerable groups. But you are quite right, and it's a good question, because, for instance, mental health and socio-occupational integration are issues which also through the COVID pandemic have shown to be extremely important in the daily life of people. I can actually tell you that later this year, the Belgian government, in the framework of this chair we have with CND, will be launching initiatives on mental health. So I would invite you, we will reach out to you on that, and I would invite you to maybe respond to that when we do activities later on in the year. There is emerging evidence in some countries that indeed people with drug use disorders, including those incarcerated, may be at increased risk of more severe illness and mortality. And of course, we are well aware that the COVID-19 pandemic has provoked challenges to prevention, early intervention and care and recovery, and also rehabilitation and reintegration. Last year, there was a resolution which focused on good practices exchange and opportunities, specifically to overcome the pandemic sequels. And for instance, what we think could be good practices and opportunities is developing and implementing innovative drug treatment and recovery delivery systems, e-health platforms and procedures. We are very much in favor of promoting efficient, accessible and durable opportunities for treatment and recovery. Now, of course, we as a multilateral organization cannot get involved in the relationships you have with your own member states, but we do try to deliver a framework and to address these issues. So I think maybe the simple answer to your question is that, like you, we are aware of these issues, and we are aware of the importance of keeping an open dialogue with civil society on these issues, and also with practitioners, so that we can then bring this issue to the forum, to our meetings, and try and help frame some international regulations which maybe can then be put to member states. So I think we are in this question you're raising. I think we are actually objective allies, CND and you, and I'm, as I said before, open to listening to civil society on this. Thank you very much.
Thank you, Mr. Ambassador. And the next question will be presented by International Drug Policy Consortium. And on behalf of the consortium, Daisy Bowdery is with us online. So Daisy, please, the floor is yours.
Thank you. We are deeply concerned over the fact that a UN human rights expert was blocked from speaking at the CND reconvene session in December 2021. How will you ensure that UN entities and officials working on human rights are able to speak and participate in the CND intersessional on human rights this autumn, as per the UN's fundamental values of inclusive and meaningful dialogue? Thank you.
Thank you very much. A very pertinent question. And if I may start by the last words you used, the UN's fundamental values of inclusive and meaningful dialogue. You have, of course, been following this session from the beginning, from Monday morning. You will, I hope, have noticed that it is the chair's explicit wish that inclusive and meaningful dialogue continues. I have given the floor to member states, also to NGOs, without any restriction. I think that in itself shows the importance we attach to inclusive and meaningful dialogue. To come to your question about this UN human rights expert, there was indeed a decision by the previous session not to present this because there simply was no consensus among member states. You know, there are quite a few people, increasingly so, including on social media, who are complaining, who are actually saying the Vienna spirit is dead. Well, I can tell you that it's because the Vienna spirit is still alive that very human rights expert can now address the session today. Without the Vienna spirit, this human rights expert would not be able to address this session. So that, I think, shows how seriously we take this. And I will, of course, allow, like in the rest of our program, of our meeting, of our agenda, I will allow various views to be pronounced. There are diverging views on this matter, and it is, I think, the obligation of the chair to allow room for those diverging views to emerge, but also to preserve the Vienna spirit. Again, those who complain about it and those who say, oh no, it's all dead now, you know, they've started to vote. May I remember all those who say that the only votes we've actually done are on procedure and are similar to the votes actually we do every year. The vote we had on Tuesday, sorry? The vote we had on Tuesday was a procedural vote. The vote we had on Wednesday was on substances, which is actually the core business of the CND. Beyond that, it will certainly be my firm ambition to keep the Vienna spirit alive and to allow, as you yourself said, an inclusive and meaningful dialogue. And in about an hour, I think we will see hopefully the result of that when the discussion takes place. So thank you very much. I may also say on this that as part of the solution we have found for this problem that existed, we have proposed that this dialogue takes place under agenda item 7, which is interagency cooperation. I think if you read this interagency cooperation properly, I think you will understand why it is under agenda item 7. Thank you.
Okay, thank you, Mr. Ambassador. Now, the third question we received is from Turkish Green Crescent Society, and Begum Özdemir is with us. So, Begum, please, the floor is yours.
I thank you. We know that substance use disorders among elderly are on the rise, especially due to the pandemic and the vulnerabilities it caused, but also because of the difficulties in identifying and addressing elderly substance use. This trend and the challenges it poses are briefly mentioned in the UNGA's outcome document, but is identified and elaborated in the 2020 INCB report, where the board makes recommendations to member states. Is Commission willing to take any improvement steps to establish a guideline to the member states on this issue? Thank you.
Thank you very much. Another very important and relevant question. And you're right, we have not until now specifically addressed the specific situation of the elderly. But as I said at the beginning, the COVID pandemic, I think, has raised awareness to all of us of the importance of leaving no one behind. We have launched an initiative on Monday where we say no patient should be left behind. This is about access and availability of substances. But it is also a broader policy, not just on the access of substances, but also on policies that we as an international community can and must take to protect the most vulnerable. It is one of the SDG priorities. It is a United Nations priority, humanitarian priority of the United Nations. So I'm very grateful to you for putting this on the agenda. There was a reference in the 2019 declaration, which said that where member states expressed concern that drug treatment and health services continue to fall short of the needs that need to be met, and where member states actually committed to ensuring that no one is left behind. And it's on that basis that we are now in 2022, 2 years later, also bringing this forward as an important agenda point. So thank you for raising this, and I promise that in the course of this year, we will try and take initiatives, including with civil society, to give put more meat on this bone, so to give more substance to this problem. I think it's an important dialogue. Thank you.
Thank you very much. And the next question is by Open Society Foundations from USA. And Kasia Malinowska is with us online. So Kasia, please, the floor is yours.
Thank you very much and good morning, Mr. Chair. Thank you for engaging with us. Last year's CND statement on COVID-19 pandemic did not acknowledge the role of international drug control system in filling prisons, which are especially dangerous for inmates and staff now during the pandemic. 1 out of 5 prisoners in the world is there for a drug-related offense. How is the CND planning to address this issue in longer term? Thank you.
Thank you very much for your question. We have this allows me actually to read out to you quite a number of references of policy references which have been taken in the last years. And although I do admit to you that they don't always specifically target incarceration, they actually address it in a policy manner. Let's say they give us a framework from which we can work further. And I think that is also the point of this dialogue we have with you, that you raise issues which we can then, on the basis of the work that we have already done, and that was done by our predecessors, that we can refine that and target it more to certain vulnerable parts of the population. You referred to the statement, but actually the statement did make reference to the vulnerable situation of people with drug use disorders, including those incarcerated. So it is actually mentioned. And we last year there was a resolution number 3, which urged member states to promote, improve and facilitate non-discriminatory access to health and care and social services, including those offered to persons in prison or pretrial detention. I'm now quoting from the resolution, which are to be on a level equal to those available in the community. So there are references, there is language, as I called it, which we can certainly use and refer to. There was even in that resolution last year a specific reference to women, youth, and vulnerable members of society in prison settings, while fully respecting all human rights and fundamental freedoms. So this shows that when you sort of, I know that these texts are very often, very long and not very, maybe not very appealing to read. But if you go into the detail of the text, you actually find quite a lot of references to some of the issues that are raised. Equally, and the General Assembly has taken a resolution 75/198, which was negotiated with CND. And again, here there is a specific reference to possible multiple vulnerabilities of women drug offenders when imprisoned, in line, by the way, with the Bangkok rules, which you all are familiar with. The UNGAS outcome document and Resolution 75/198, member states are recommended or urged to enhance access to treatment for drug use disorders for those who are incarcerated, to promote effective oversight, to encourage self-assessments of confinement facilities, to observe the Nelson Mandela rules, to implement measures aimed at addressing and eliminating prison overcrowding and violence. So these are just a few references which are in established text, which address these problems. So, of course, we're very open to continue the dialogue on this, but I would be actually grateful if anybody who addresses these questions would refer to these texts, because a lot of work has gone into them and they are established multilateral language. Thank you very much.
Thank you, Mr. Ambassador. Quite a few questions are related to COVID-19, so this is obviously a very emerging issue also among civil society organizations. But the next one is not connected with COVID and will be asked by the Community Anti-Drug Coalitions of America, CATCA. And Irina is with us today online. So Irina, please, the floor is yours.
Thank you, Matej, and thank you so much for the CND chair for this opportunity. Our question is about prevention indeed. Community-based substance use prevention is a sound investment, with every dollar invested having the potential to result in savings of between $2 and $20. Could you please explain how the CND will collaborate with member states to ensure that community-based substance use prevention becomes a higher priority for emphasis in response to the world's drug problems? Thank you.
Thank you very much. Again, another very, very important aspect of our work. I think I can speak for the Secretariat when I say that here in Vienna, we are fully aware, and actually we appreciate enormously the involvement of the community level in bringing forward the key messages that are developed here in Vienna. So we see the community level, the first line responders in a way, as key allies in bringing to the field and in implementing all the big decisions and principles that we arrive at here in the multilateral framework. So it is obvious, certainly to me, and I think to all the people here in working at the UNODC here in Vienna, that this is a key link. And I would say, on a personal basis, the closer that link is, the better it is. And I know if you've listened to the reports by Angela May and Giovanni Campello yesterday on all the research that has been done. That research cannot be done unless it is fed by community level input. So first, the first answer to your question is that this is an essential link between us here doing multilateral and policy work and the first line community practitioners. Now, your question is on prevention, and we have again quite a lot of established language, as we say that in our world, quite a lot of established principles and agreed texts which refer to that. I won't read them out, all of you, but I have here at least 3 resolutions over the last 15 years which refer to that. And a resolution is a policy document which is agreed by member states. And and again, there's a lot of technical language and a lot of diplomatic language there. But the key factor here is that resolutions are the voice of an agreed decision making by member states. I think, if you allow me to put that forward, I would ask, for some understanding and some respect for that. That this is the common will of member states, even those who are not always totally, in agreement, to actually bring forward policy. So I can assure you that this aspect of prevention, like the 2 or 3 other aspects which we've already discussed, is actually very much at the forefront of our minds. And I think here again, I'm certainly open and eager to engage in further dialogue with you. Later this year, we will have thematic discussions, and I'm looking at the Secretary. Do you want maybe to speak on prevention or on the thematic discussions? Can we incorporate that? I can certainly make a commitment that we can focus on prevention in some of the various activities that are planned throughout the year. Joe will give some more.
Thank you very much, and good morning to all. It also gives me the opportunity to say that unfortunately I will then have to leave shortly to go back to the plenary and Doris, as who you all know, will stay here with you. But first of all, thank you very much also to the NGO, Vienna NGO Committee for organizing this meeting and for also enabling us as a secretariat to participate. And we are in a way very happy with the very close cooperation that we are having. Now, as you know, the thematic discussions are indeed a forum bringing together member states, but also a very broad spectrum of stakeholders, I would say, and in a way it enables all these issues. Of course, it has every year a focus in line with the challenges that have been defined in the 2019 ministerial declaration. But as you know, these challenges are usually formulated in a rather broad way. So of course, prevention can be brought in under any of these challenges. So it will definitely also, this opportunity, provide again a chance to NGOs who are doing very concrete work on the ground, because that's also where member states are particularly interested is in how can they really also see how the, as our dear Ambassador Dope was already saying, the commitments that are agreed upon by member states, how can they be implemented on the ground? And all member states are seeing a big role for NGOs in that perspective. So very concrete work that is done on the ground that in a way makes sure that what is agreed upon here is also translated into action, is something that is a very valuable contribution to those thematic discussions. So thank you very much.
Thank you very much, Joe, and look forward to engaging with you later in the year on that.
Thank you. Do you know when this thematic discussion will take place? Sorry.
Thank you very much. Well, as we know, the dates are usually in autumn. But we also have to see, as you meanwhile know, getting conference room space in this building is also in itself a challenge, because we are sharing the building with other UN entities here. So we are not necessarily, we have to see also when this meeting can take place. But it will, as usual, be in the period between September and November.
Okay, thank you. We will follow and also inform civil society organizations about this interesting thematic discussion. And also, if I'm allowed to say that another important resolution related to this question was drafted by Slovenia, France, and Nigeria on early prevention. So this will be another puzzle in this story, and hopefully it will be adopted tomorrow. And it will be put in place or implementation in the following years. So the next questions, the question is from Instituto RIA from Mexico, and Daisy Bowdery will present this question. Daisy, the floor is yours.
Thank you. Regarding civil society participation, how can we consolidate the gains that have been made from the virtual participation during COVID, while also retaining and expanding civic space that has been lost because of COVID restrictions, particularly related to being in the CAO negotiations? Thank you.
Yes, thank you very much. It's a question about the workings of our session. Indeed, we must admit that COVID has been and still is a challenge. And although technology allows us, of course, to engage with people from all around the globe, even if it is in the middle of the night, it is not the same. And especially in terms of engagement, it is not the same. But civil society participation, certainly as long as I've worked here and I'm working with the UNODC Secretariat, it's always a priority. We are always, whenever we organize a meeting, there is always the element of civil society participation. But thank you for raising this. We can certainly do much more. we have, we have told member states that their participation is limited to 2 per member states. So that is actually one of the reasons for that, is also to allow room for you. Because if we had, even though the room is big, but if we had said, for instance, 3 or 4, like some member states asked it to do, you would not have been in the room. So we have voluntarily limited to 2 per session. 76 of you were here last year, or attended the session. I think partly online as well. This year, 56 side events organized by NGOs were organized by NGOs out of a total of over 130. So that's, it's not half, but that's a good percentage. And we're really open to other innovative ideas. But I think the important thing, as you all know, the sessions of the CND are public sessions. So it is not more than normal that that attendance for non-member states is secured. So and I will certainly see to it that that is the case throughout my chairmanship. Thank you.
Okay, thank you. I participated in one side event discussing this issue on behalf of Vienna NGO Committee as well. So there are also some positives. So we actually engaged more civil society organizations and speakers during the COVID period. So there are, of course, some positives, and the future will definitely be hybrid.
I think so too.
And yes. So we will be able to engage maybe even more organizations.
Yes.
So not only the bad things happened in the previous years. So thank you very much. And the next question will be presented by Jamie on behalf of Rare Youth from Mozambique. So Jamie, please, the floor is yours.
Yeah, sure. So Mr. Ambassador, if you'll permit, I want to just read out a question from one of our members from Mozambique, Riajud, who aren't able to join us, it seems, on the call. So the question goes, what mechanisms exist to regularly support the participation of country delegations to the CND sessions, including stronger recommendations for civil society participation on the country delegations? Thank you so much.
Yes, thank you very much, Chairman. Jamie, you were hidden by a screen. I'm sorry, I didn't see you at first. Yes, no, it is a recurring fact. It is a member states constitute their delegations. Member state can actually include NGOs in their delegation if they so wish, and there are member states who do that, and that is established practice. As you know, even there is also established practice that governments can nominate one representative to actually receive an airfare reimbursed. So there is even, with the generosity possible for that. But of course, it is the prerogative of member states, because the inclusion or the support of country delegations, is not something which the chair can impose. Member states are sovereign in deciding whom they appoint to their delegations. But there is flexibility, and it is certainly something that you can point out to individual countries that it is open to them to include you in the delegation, or to facilitate access, or to lobby for you with us. Thank you.
Okay, thank you very much. And the next question came from FAAAT from France, and Kenzie Riboleza-Moli is with us online. So Kenzie, please, the floor is yours.
If you can hear me. Okay. I assume
yes, we can hear you.
Okay, great, thank you. So I'm sorry, but I have to just make a short follow-up question on this session and the need for access and participation of civil society. We are aware that in the past, during the COVID pandemic, the Secretariat has facilitated the upload of written contributions online on the website to share with member states. That's something that usually we would do in the VIC. We have tables for civil society where we can display reports and longer substantial contributions to assist in the discussions of the Commission. And because we cannot do that on the tables in the lobby this year, we would like to request the Secretariat in continuing to facilitate the possibility to upload some contributions online for access to member states. I say that because my NGO yesterday in a statement in plenary wanted to share one of these substantial contribution with member state, and we wanted to put it on the Secretariat website. We indicated it in the statement in plenary, and now it would be good some member state could have just access to this contribution if they want. So I would like to highlight this and request that this could be facilitated. And just shortly, my question was about the INCB. So given that the CND is the governing body of the UNODC, which holds the secretariat of the INCB, I wanted to follow up on a statement sent last December by 180 NGOs to the CND, highlighting concerns about the lack of transparency and accountability within the INCB. Scholars have found that the INCB is more secretive than the Security Council of the United Nations, so it's somehow concerning. We would like to ask if the CND could be able to facilitate and assist the INCB in making some efforts to increase transparency and accountability. Thank you very much.
Sure. Good morning. Doris Resch from the Secretariat will answer your question on availability of documents. Maybe first, Doris, yes.
Yeah, thank you, Mr. Chair. And thank you very much for the question. And I think you've been in contact with my colleagues that have also tried to explain. Of course, I mean, there are a lot of options also to submit written statements. There is a deadline because we really need to process documents. This is not something, and it's not 1 or 2 documents that we're receiving. So there is this deadline of the written statements. You also have the opportunity, because you were referring to the tables out of the side events, you did have the opportunity also for your side events to make sure that the documents are shared through your side events, that flyers are shared. So we do try our best to make sure that the same possibilities are there. It is really, this has got nothing to do with your statement, but it's just at the moment all the general debate statements are being posted and just not on all the different agenda items. So it's just a very practical thing. And I think Jamie wants to add something on this.
Yeah, if you'll indulge me, I think, Kenzie, I see your point that one of the things we have lost is the NGO table of all our reports. So maybe if we do go into future CND meetings still in a hybrid fashion, this is something that the NGOC could pick up, and we could provide some, I don't know, I'm thinking like maybe like a virtual NGO table where we can upload the reports and the materials of the members and then share that link with member states. That could, there could be a virtual or a hybrid version of an NGO table in the future. We just didn't think of it this year. I apologize, Kenzie.
Yeah, and if I may add, we would be absolutely more than happy to make sure that that link is then also on the website of the Commission, where everyone has access that is joining the session. Thank you.
Kenzie, we'll touch base on this, Kenzie, and this idea and how we make it. Yeah.
Yeah, thank you. No, I think that is we need to be innovative. This is going to be with us for a long time, hybrid scene, as you were saying, already. So, so indeed, I'm certainly open to that. On your question on the INCB, maybe I try to dissipate two misunderstandings. First of all, the CND does not hold the Secretariat of INCB. We are in the same building. Actually, I can tell you that INCB is a separate part of it's actually not part of UNODC. It is its own standalone body. And you mentioned, secretive. It's a quasi-judicial body. Quasi-judicial. I mean, it's not a court. Of course, it's not a court, but it has judicial powers. And that explains, I suppose, why. I'm not here to answer for them, obviously, but I'm here to answer your question. But they have a very specific statute. So don't compare them to the work we do. As I just said in the previous intervention, the CND is an open, it's not a forum, it's a decision-making body, but the decision-making of the CND is open because we are a UN organ. The INCB is an autonomous, self-standing body of 14 experts, which has treaty-given judicial powers. So I think that goes some way into explaining explaining your question. I can't get into more detail than that. It's not really my job, but I think if you take these two things in mind, it may help explain why the situation is the way it is. If I may say, I have been working very closely with them. I have seen the president at least 4 times now. I was invited to their own board 5 or 6 weeks ago. So we do interact with them, and I try and put them to our responsibilities. And for those of you who followed the decision making, the scheduling yesterday, I think you will have noticed that we have a good contact, but we do have to respect their own specific mandate. Thank you.
Thank you. We have informal dialogue with them later this day, so maybe if there will be time, we can ask them about this this topic in more details. So we will have opportunity to bother them with this. Thank you. And the next question is from Students for Sensible Drug Policy from United States, and Eloisa Schwartz is with us. So Eloisa, the floor is yours, please.
Thank you. We would like to commend the UNODC for providing the Youth Forum with a platform to discuss how youth can be more involved in addressing global drug issues last year. Understanding that a lot of this discussion focused on local efforts, we would like to inquire if there are any plans to expand the influence, power, and/or opportunities provided to the Youth Forum when engaging with the decision-making and policy creation functions of the CND, particularly during the main session and thematic intersessionals. Thank you very much.
Thank you very much, Julian. Good to see you again. You were online yesterday. Yes, well, the Youth Forum, I took part, again, virtually, in the Youth Forum. I wish I could have had more time, because actually, I gave an opening statement, but then, I had to leave. There were certain things going on a few weeks ago. So I would like to engage with you, because I just gave a statement, but then I wasn't really present during your forum. So I'd like to find an opportunity to do that again. That is just my commitment. But on your question, well, I mean, in about 20 minutes, you are about to address the CND. So I mean, that I think is the first part of the answer to the question. And it has been a very good established practice for 10 years now, since 2012. Lots of young people have participated. Member states designate, member states don't designate them, but they are chosen and then sort of put forward by member states. Sorry, which shows, I think, also that from the very beginning, from the moment that you choose your representatives, member states are engaged in promoting your role. But of course, I do agree with you that more can be done, and I take on board your suggestion that maybe on the thematic discussions later this year we should include you more. So on the question of interaction with the decision-making body, with the CND, well, you're in the session in 20 minutes. And it is an intervention. It's not a whole day, but at least it is there, and member states can hear you. And further to the year, I'm again more than happy, and I think we should organize, like with the NGOs, maybe a special interaction with you. So we'll reach out. We reach out to you and have a discussion to which I suppose, of course, NGOs will also be invited. I look forward to that. And may I say, I'm extremely pleased also to work with young professionals and young colleagues in the Secretariat. And I would not be able to do this job without people like Doris and Wei Ming and Natalie. So thank you for that. So yeah, there's also a lot of possibilities for young people to do very meaningful work in multilateral affairs. Thank you.
Okay, thank you, Mr. Ambassador. The next question is from Fields of Green for All, MPC, South Africa. And Myrtle Clark is with us. So Myrtle, please, the floor is yours.
Hello, and thank you very much for taking our question today. My question for the informal dialogue with the CND is as follows. How does the CND intend to reconcile the WO's stated fact that cannabis does not belong in Schedule 1 based on the other drugs in Schedule 1? The WHO didn't recommend moving cannabis from Schedule 1 because implementation would require redrafting of the single convention. How does the CND intend to move forward in implementing the necessary changes to the convention? My particular area of interest here in South Africa is the traditional use of cannabis, as we have been cultivating cannabis for over 700 years in Southern Africa, and we are looking towards reconciling our traditional production with the conventions. Thank you very much.
Thank you very much, and also good to see you again. You were linked to us yesterday as well. Well, you will have noticed that cannabis is not on the agenda this year, for one very good reason. It is that 2 years ago we had a very extensive discussion on that under the very able guidance of my esteemed colleague from Pakistan, Ambassador Khan. It was not an easy discussion at all, and I think it continues not to be an easy discussion. Your question is about redrafting a convention. I'm not a huge multilateral expert, but that is a process. If it is successful at all, which takes years and years, and which takes a lot of convincing, like you just said. I think a lot of lobbying is required, and with all due respect for traditional ways of traditional medicine. We are well aware, of course, that traditional medicine is very important, not just in certain countries, but also in among many people in the population. So I think this is typical. It's difficult for the chair to give a real answer to that because it's not on our agenda. But my feeling on this is that civil society should continue to play its role and lobby your politicians, not just in your own country, but also in other countries. But of course, you will realize, like we realize, that not everybody sees it the same way. But that is typical for our work and for our dialogue. That we need to come to a solution, which is agreed by everyone. But I mean, my feeling is that the more this is known, the more people are aware of the traditions in your country, also maybe not limited to your country, but like we're doing today, raising it, the better it is. We are held by treaty, we are held by recommendations from either the World Health Organization or the INCB for scheduling. But then, of course, those are recommendations, again, like happened yesterday. And then we decide, and in that decision-making process on cannabis, I mean, let's be open here and frank, there's no consensus. There are very varying views on what is called, the traditional use or the recreational use or whatever you want to call it on the one hand, and the strict medical use of that. Again, I'm not an expert, but it is obvious that for the moment, I do not see any, say, multilateral consensus on this, and certainly not on opening up the convention. I think that is not, because the convention, of course, is extremely important for extremely dangerous substances. So the danger in opening up is that you then open up. I mean, there's some very powerful lobbies which are pushing for liberalization of extremely dangerous drugs. And if we lose, the international treaty-based control mechanisms, then that also opens up a huge danger. So, I mean, these are my personal views. I, don't ascribe them to the chair or to the CND, but I want to help you and give you my views and help you understand the challenges I think we're facing on it. But it is growing awareness by politicians and by decision makers, I think, which will bring this forward. Thank you.
Great. Thank you very much. Thank you very much.
Thank you.
Thank you, Mr. Ambassador. And the last question on the list, but if there will be time, we have some one or two more. The next question is from Virginians Against Drug Violence from United States, and Michael Kravitz is with us online. So Michael, please, the floor is yours.
Thank you so much. Had some strange technical difficulties yesterday, and I appreciate so much the chair's compassion and assistance in getting through the moment. Today, the question that I have revolves around the change in the treaty with regard to cannabis. I was going to read this quote. Of course, the World Health Organization said that some patients with chronic pain have also been shown to obtain relief from cannabis preparations when other available medicines have not been effective, end quote. And to ask what the CND proper can do, I just want to elaborate on that question a little bit, that there was quite an extensive process before the vote where member states were basically helped through the process of this unprecedented move to remove cannabis from Schedule 4 of the Single Convention, but there was nothing after the vote. And I think the United States and many countries, I'll say first, have, I think, implemented already dramatic changes in their national laws as a result. And of course, the International Narcotics Control Board, I think, is furiously working on trying to sort of bring their guidance to member states up to date. But the United States, I think, is floundering, it seems, on how to handle this. And it's an unprecedented thing. We have never had a reform of the treaty, certainly not one of the pillar drugs. So look forward to your input on that.
Yeah, thank you very much, Michael. I think you were, yeah, indeed. Last night, it must be extremely early in the morning where you are now. So yes. Thanks. Yeah, I can see you against a very dark background. I got up very early as well. So sympathy for you. Yeah, your question is about how member states are informed and how the sort of post-decision process is brought forward. Again, we're a member states-driven organization, but the CND and the Secretariat do their job in communicating actually to the UN Secretary General, to all member states, the decisions that are taken. So the way in which member states are informed, well, is first of all because they're in the room, obviously, but also formally, they get the formal decisions that are taken sent to them via the United Nations circuit. So member states are formally advised of all the scheduling decisions that we have taken, like the ones yesterday. And again, as you may have seen yesterday, this is all very transparent and straightforward. I mean, member states have to lift their country sign, and everybody can see who is for or against. We also have, I think a very good website where all this is put, but of course a website, is one thing, but we also need to actively communicate. My predecessor, Ambassador Khan, issued a press release after the decisions 2 years ago. So again, that also helped. But you know that there is the WHO model list of essential medicines, which is 45 years old. Dr. Tedros referred to it in our joint call on Monday. And we are, actually, it's a priority of this chair in my country. We are devoting attention to scaling up the implementation. So actually, part of the answer to your question is that we are aware of the fact that implementation must be observed by everybody, and that there is a need to scale up the implementation of the commitments. What we are doing is specifically on availability and access of substances for medical and scientific purposes. So that is one part, but your question was wider, and we will take it on board. And thank you, and have a good day. Thank you.
Thank you very much, Mr. Ambassador. Do we have time for? Okay, so Catherine, you wanted to ask another question.
Thank you. Yeah, thanks.
Floor is yours.
Great that there's time. So good morning, Mr. Ambassador. And I don't want to put you on the back foot with a question you didn't prepare for, but I'll just state the question. IHPC understands that CND is beginning to accept the message about the importance of access and availability to essential medicines after decades of focus on supply control. Belgium has been helping to advance that initiative to create what I think of as new neural pathways at CND. And as you emphasized on Monday, this invokes the principle of mutual and shared responsibility for wealthier member states to support those with more fragile health systems to develop their human resources and improve access to medicines like you're doing in the Congo. And to prevent the global spread of the North American opioid crisis, which I know many member states are concerned about, the Lancet Commission on the North American Opioid Crisis, launched in February, recommended that, quote, the World Health Organization, with support of donor organizations, should coordinate delivery of generic morphine to hospitals and hospices in low-income countries. So this is a whole new, very radical sort of initiative. And this action, I'm continuing to quote from the report, this action will require the support of the INCB, which oversees the UN Conventions on Narcotic Drugs and Licenses and regulates illicit opioid production. So we'll be talking to them about that this afternoon. But is there a possibility that Belgium could support such a recommendation, which comes from the highest levels of academia in the EU and its member states, given the global situation which Belgium now knows so well? And as I said, of course, I don't expect an answer today, but it's just something to think about.
Well, thank you very much, Catherine. And I'm very glad that you asked a question, which you actually did announce you were going to ask. So it isn't, it isn't a problem at all. Quite contrary, I'm very happy to engage. We've been engaging quite a few years now. I'm extremely proud that Belgium is carrying this access and availability initiative forward, and there is some money for that. Our Ministry of Health has a budget on that. Of course, nothing is ever enough. I think what I will do is take this question and this remark forward. Bring it forward to my national authorities, obviously, but I think we will also take on board the broader problem in question. It's one thing we really want to do, and that was the purpose of our joint call, is to raise awareness. I think we start there. And raising awareness is also, of course, based on scientific evidence, and on, not just scientific, but also, sociological and other evidence. And one of the key points which I think my country, if I can speak for Belgium for 1 second now, is certainly looking at is technical assistance, because we are. I mean, these are substances which are extremely delicate to handle. I can give you an anecdote. A month ago, I visited the UNODC lab, with Justice Teddy, who was there yesterday. And Justice showed me, there's some footage on that isn't there, Doris? Justice showed me, so Justice told me minute quantities of fentanyl or fentanyl precursor. And he told me the precautions they take even here on those ridiculously minute, laboratory size samples. He gave me a very, very strict security briefing on that, just to show, first of all, how seriously UNDC takes it. That's obvious, but just to show how aware we are that, if some of these substances, fall into the wrong hands or are made substandard, or then the worst things obviously can happen. So we think that capacity building and technical assistance is probably certainly an area, and I look forward. I told Justice I want to go back to his lab and learn much more about this. So, but I think technical assistance and capacity building is certainly something. I think I can speak for my country here, which we will be working on. We are looking for broadening actually the donor base, and of course, and maybe to wrap up then, there is the joint call we launched on Monday. Also had the hashtag No Patient Left Behind. So I think that's also the framework in which we want to see this, and I think that's very much in line with UN and also WHO practice. We're looking at an e-learning tool. With the Secretariat, there will be a one-day forum on this, which I'm sure you'll want to attend. We are also. I think I would also like to reach out to Geneva personally to hear more specifically how this. So there's quite a lot of things. There's a Team Europe initiative Adrian is just telling me about. It's quite a lot of things that we have in mind, and we look forward to engaging with you and hopefully also to get your support on that. Thank you. I'm sorry. Youth Forum in a few minutes.
Yeah, thank you, Mr. Ambassador. It was our pleasure to discuss with you in this informal dialogue. And we covered a lot of important issues. So thank you very much. And I wish you a great work here at CND and also after the CND.
Thank you very much. Well, thank you for this dialogue. It was a pleasure to engage. I wish also you every success with your own activities. And I really look forward to engaging through the course of the year. Thank you.